So welcome back, everyone. This is going to be very interesting. I am very excited about bringing on my next guest, who is Dr. Singh. He's the co-owner of Gastro Center. Welcome to the show.
Thanks, Carol.
You got to tell everybody what it is that you guys have come up with. It's phenomenal. Listen up.
We started this program, as you know, obesity is extremely common. So last year, FDA approved a new technique where you could put a balloon in somebody's stomach to decrease the capacity of the balloon for about 6 months. It's a temporary thing. And then basically decreases the intake of calories. As you know, obesity, one of the main reasons is to eat less quantities of food. We overeat, and that's main cause. I mean, there are other causes as well. But anyway, we then took that and also along with it added few other things which are very important for treatment of obesity, and so we made a program around it for about a year where you have a balloon in your stomach for this, and then a nutrition element where a therapeutic nutritionist, which we work with, gives advice on what to eat, when to eat, how to eat over this period. And we monitor them electronically, with through Fitbit and, basically their weight, all this stuff. And then in addition to that, we also thought that since obesity, we feel is not only just a physical disease, but it's of course, mind is involved very much in this. We eat, and apparently we have found out that eating gives us pleasure. So it's like a happy.
It's a drug.
It's a drug. It leads to what we call these release of happy hormones in our brains. There's a part of the brain called striatum, where this dopamine you probably have heard about. It gets released. Dopamine is a good thing. Basically, the body feels very happy. So excessive food leads to its release, and we feel good. Same thing we have noticed or found out is that in certain other addictions, similar things happen. Like for example, marijuana, heroin, cocaine. They also do similar things in the brain.
You're just finding this out now, Doc?
No, it's actually, interestingly, a lot of studies have been done. Endorphins, you've heard about. Sure. All these are good hormones. They get released. So, in a way, basically, there has been a lot of studies being done, even in humans and mice and all that. And what we are finding out is that after a while, just like other drugs, the more we eat, so the less pleasure we get. So to get the same amount of pleasure, you have to eat more and more. And that leads to the accumulation of excessive fat in certain parts of the body. And that leads to insulin resistance and resistance to other hormones, resulting in what we call a metabolic syndrome. And that's extremely common. In the U.S., for example, if you really look at it, 1/3 of the population, that's around 33%, of people are qualified as obese, and another third of them are qualified as overweight. Mm-hmm. So we generally, as you probably know, we basically classify them as just a weight as an index of height, which we call a basic metabolic index, or BMI. You heard the term. Mm-hmm. So if you're between 25 and 30 or less than 25, you're good. That's it.
There's almost everyone would probably fit in obese and not realize it, right? I mean, because it's quite amazing of what obesity is really considered, right?
Yes.
Now, I want to talk about the program because I want to ask you some neat things that I have in my mind already that I want to ask you.
Sure.
Okay.
Yeah.
So the program is done. Is it a program where you come in and you get this balloon put into you, into your stomach?
Yes.
Okay. That's done in your office. Is it an outpatient situation? How does that work?
It's an outpatient situation, yes. But it is, you will give a minor sedation, so the patient gets that done. Takes about 20 to 25 minutes. We endoscopically go through a mouth, just like upper GI endoscopic examination of your stomach. So we go through the mouth and place that in the stomach. And in 25 minutes, we are done. Patients back home the same day.
And do so they don't feel anything? There's no pain involved?
There's no pain during the procedure at all because they are just, in that twilight.
Then what happens?
then what happens is that because we have introduced this balloon in the stomach, and that's occupying a space.
Something different.
So the first 72 hours or the first week, or, the patient experiences certain amount of discomfort, nausea, because suddenly the stomach has a capacity of about 1 liter or 1,000 ml. And we put these two balloons, which total around 900 cc. So basically, you're trying to...
So for a little discomfort, though,
Yeah.
you keep them in there, you said, for how long? 6 months?
6 months, yeah.
And during that 6 months' time, they can expect to lose a lot. How much weight?
On an average, when the study is done, about 30 pounds on average, up to... and you could actually... People have lost more than that,
Right.
60, 70. I mean, huge amount of weight, because it's just not only the balloon. The balloon is a temporary fix to decrease the things. But what we work on is the other two things which we're talking about. That is nutrition, basically changing their lifestyle. What we are trying to do is we're trying to change your relationship with the food, why you eat the way you eat.
Right. So it makes sense, because of course, everybody knows no matter what diet you're on, you go on the diet, you lose the weight because you're following the diet, but then guess what? You gain the weight. But what you're saying here is, yes, you're going to put that balloon in there, and yeah, you're going to lose some weight. You're going to obviously do that because your stomach's smaller, but also, or I shouldn't say your stomach's smaller, there's no room for the food in there. But also, you are actually going to do a program that they do follow with you, where you're going to learn nutrition. You're going to learn how to change the way you eat and how the way you live on your eating end.
Yes.
Correct?
Yes.
That's awesome. So now you're located in Chandler. Your website is gastrotrim.com.
Yes.
And your phone number is 480-757-8000. Do you do a consultation?
It's a free consultation.
Yeah, you have to do a free consultation for them, because they have to talk and find out.
Absolutely.
Who's the candidate?
Anybody who has a BMI of more than between 30 and 40 is a candidate.
Okay.
So basically, and it's very easy to calculate that. You just go online and just say BMI calculator. You put your height in inches and your weight in pounds, and you suddenly have a number. So if your number is between 30 and 40, you're candidate for this program.
Okay. Now, you're going to give everyone that's listening that needs this, and it could be someone that you know, too, your loved one, or someone in your family. There's a lot of kids. Can kids get this done? And how young can they do it?
Right now, they're only 18 or above.
Oh, that's fine. Yes. That's fine. Yeah, because this is a new procedure.
New procedure. We came in last year, so it was approved for adults right now.
Okay. So 18 on up. You're going to be giving everyone, it's a Fitbit, so that's to monitor your weight and your food intake and calories and sleep. That's $150 value free to you. They would like to talk to you about your issues. We're going to have everyone call in here right now. You can start calling and everyone's going to get it. 602-277-5369. Toll free, it's 1-866-536-1100. So the benefit, okay, of to reset, I don't know what you call this, the reshape procedure.
Yes.
Okay. The benefit is what?
Benefit is that, as you know, weight or obesity, as you know, which is endemic in the United States, costs us, if I can give you the magnitude of all. In 2008, they did an analysis on how much it costs annually, about $157 billion annually we are spending on obesity and obesity-related disease processes. And since then, obesity has doubled. So you can think about $300 billion. That's direct cost of it. What are the benefits to an individual? Obesity is part of what we call or predisposes you to a metabolic syndrome. That is diabetes mellitus, high blood pressure, stroke, certain cancers, breast cancer, colon cancer, you get predisposition to it. So, and hyperlipidemia, your lipids are high. So cancer, stroke, heart disease, you name it. All these things, as you know, when you turn 50 and then you go to the next phase, all these become a problem.
I'll tell you what, guys, this is really neat, and it's very new, but they're offering it, and they want you to hear it right here on Networking Arizona. Everyone's going to get the Fitbit more, that which you're going to get from us. It's $150 value, free to you. Call us here at 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. It's gastrotrim.com. We'll be back in just a minute.
We say, what are you doing new? Or,
Okay, here we go. We're live here now, Doc. Okay, so we're welcome back, everybody. We're talking with Dr. Singh. He's the co-owner of Gastro Trim Center that's located in Chandler. This is really neat because it's relatively a new procedure that you wanted to talk about.
Yes.
Yet it's safe.
It is. The studies which were done to approve this, or the studies which were used to do that, there was a study out of Spain, Madrid, in a teaching hospital where they did it on 60 patients. There were no major complications during that. Then there was a facilitatory study here in the U.S., which was published, again, in the Braddock Surgery Journal. And there were 326 patients involved in that. 187 had balloon, and 139 were the control group. And there were no major complications from that, like perforation, migration, and all. Balloons have been around for the past, 15, 20 years. But this particular type of balloon, which is a reshaped balloon, has certain advantages over those. Now, they are in fact two balloons rather than one balloon. So the advantage is there used to be a complication called migration. If the balloon deflated for some other reason, it'll go into the small bowel and you'll have to take them out surgically. Having two balloons means that if it, less chance of, if one of the balloons got deflated, the balloon still stays in the stomach. But what we do, interestingly, is we put methylene blue dye into both the balloons. So when the balloon deflates, the methylene blue gets absorbed in the blood and comes out in the urine. So patient immediately knows that one of the balloons, and they contact us. And we replace that, both the balloons, of course, free of cost. So basically, we absorb the cost of that, and so the patient is not harmed in any way. We replace that. So it's a pretty safe thing.
Doctor, what also is there's no incision. You're drilling down. That's, I think, the best, too.
Yeah.
Because the downtime is obviously very, very little. Minimum. Yes. You said that basically they do have to be, they're going to have some sort of, they're going to be, I don't know the word I'm looking for right now, but they have to be, they're going to... sedation for their, that was
conscious,
the word,
twilight. Kind of.
For a little bit.
Yeah.
But, of course, it's a 25-minute procedure. They go home, they're going to go to sleep, wake up, and basically be able to do anything they need to at that point?
Absolutely. Yeah, they're just
so much easier.
Yeah, it's because as we know, the other alternative too, especially the people who are really obese or BMI of 40 or more, there is surgery, gastric bypass surgery, as you know of. But that is basically changing the total anatomy of your body. It's, cutting off like 90% of your stomach, making a small pouch, and then putting it back together with a small bowel. Now, what does that is not only there are acute complications, from acute surgery, but chronic malabsorption is introduced. So basically, people over a period of time start to malabsorb or not have good absorption. They become deficient in minerals and vitamins, and so the other things are more drastic. So this is a temporary adjuvant we do basically to decrease or forcibly decrease your appetite, and then we have in place long-term things, and we talked about that a little bit, that we, in addition to the nutritionist giving some sort of advice on what to eat, how much to eat, we also have one of the premier psychological services in the Valley, and those are the PCSs or Scottsdale, who have a great amount of experience in other issues, especially addiction problems, and they are going to follow the patient for 6 months. They're going to analyze, suggest people how to do that. So basically, as I was saying, that we want to change the relationship with food so that when the balloon comes out or any other temporizing, methods, this stays with the patient for a long period of time. So
long term.
Yeah, long term.
It's safe. And sounds to me like a very nice way to go, as opposed to doing something that you're going to actually change the anatomy of your stomach, as opposed to doing something like this. And I think the best thing to do is anybody who's listening to do a free consultation with them, to talk to them and see where you're at. See, obviously, if you are a candidate, which you said that you can find out pretty easily with that, and how the procedure works. Again, you can check them out at gastrotrim.com. Their phone number is 480-751 757. Oh, 757 8000. So 757 8000. And they are now. Again, obviously, they want to work with you. That's the whole point of this. It's not just to get a Fitbit, but we want you to be able to have that, and he does. So he's giving anyone who is listening that would want something like this, you're going to get the Fitbit from them. It's $150 value. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. They have to have the Fitbit when they do the
sure,
because that's how that's the whole. It's part of the program to have that, right?
Absolutely,
okay.
Because we monitor them electronically with all the things. They don't have to come in to check out their weight or things like that. So we can know what's happening to the patient on a regular basis.
So here's what everybody wants to know. Can they eat whatever they want, even though it's a little less? It's less?
Absolutely. So if you see, there are so many diets out there. There are so many variations of that. There are so many programs with that. But the constant sort of a feature, or what we have figured it out is the refined carbohydrates, or the sugars. Remember, I was talking to you about the addiction is the sugar. Sugar is more addictive than cocaine. It's about 100 times. If you go in a supermarket today and you flip the thing off, you will see that sugar is part of, it's called high fructose corn syrup. That is part of almost everything sweet we eat today. And that's very, very much addictive.
Yes.
And so one thing you have to do major in your diet process is to decrease the amount of calories that are coming from sugars, and have more carbohydrates, proteins, fats.
Complex.
Complex. I mean, but the refined or the sugars, you definitely need to decrease in your diet.
And that's where you also come in, because you have a nutritionist.
Yeah.
Okay. You also have a psychologist.
Yeah.
Right. And also, what about exercise?
Exercise we do, yeah, but that's also part of the things that we advise them on how much daily exercise is needing. There are enough studies to show that if you exercise daily for about 30 minutes a day, then you can decrease your chances of getting into the metabolic syndrome. So we advise them, and even simple modifying things in their day-to-day routine. I'll give you an example. Say, for example, if you go to supermarket to shop, generally you drive up close to where the door is. So by just changing your behavior, that you park at the furthest corner from the supermarket. You walk. I mean, it's simple, but it's a behavior modification. So that's what we're trying to do. There was an additional thing, Carol, I wanted to mention that what we are doing. We are introducing, also, we have found out, or studies have found out, your gut bacteria, which you live with, is different in obese patients as compared to normal healthy patients. So the gut bacteria has a role in formation of obesity. We found that basically in rats, where you can take away bacteria, and then rats started eating like crazy. So these experiments also affect the way a person eats. So during all this program, we have identified those probiotics which are good for this, and we give them as part of the program for the whole year.
You got to check them out. It's gastrotrim.com. They do free consultations. Their number is 480-757-8000. They do free consultations. It sounds like a great program for people who have also had trouble losing weight.
Yeah, that is one of the main things. That's because most of the programs fail. Diet and exercise works in about, you decrease your weight by about 6 to 7% of your excess body weight. But it's like a yo-yo. The moment there's a lapse in it, you come back. And the lapses are due to these long-term things where you keep on doing the same behavior. In fact, there is evidence that even after such drastic surgeries as gastric bypass surgeries, you put your weight back on. unless you do this, modify your behavior. And that's what we're trying to do. I also want to mention, Carol, is me and my partner, Dr. Brendan Levy, both of us are, based out of Chandler, Arizona, and we are available for this free consultation.
So they will actually do the talking to you. So you'll actually be the one to talk to them.
Yeah.
So again, we have our lines open here, and everyone who does call in is going to get the Fitbit from us because we want to help anybody out there that is heavy, and it could be, you have to just fit in the criteria, but most everybody probably does.
Yeah.
And our number here is 602-277-5369. Toll free, it's 1-866-536-1100. And I'm going to let everybody call throughout the rest of the show for that. Last question, because I know we're going to go. I know it goes by so fast. Is it possible for the procedure to not work for somebody?
Yes, absolutely. Because one of the main ingredients of the whole sort of process, as you know, is that their capacity to change their behavior. If they are not ready for that, they will be back to the same weight again but we hope that all these things which we're introducing outside the physical component, that is putting a balloon in the stomach. But again, if they don't follow through with all the psychological, the nutrition help over a period of time, then it can fail.
But if there's so many people out there that are, we're overweight, especially as Americans, you know. And if you had a hard time with it, you've been dealing with it for a while, 18 and older is what they'll help. They do free consultations. That's what you need to do. You need to write the number down, find out how they can help you. It just sounds like a much more safer way to go, obviously, than having yourself cut. I love it. GastroTrim.com.
Yeah.
That's great. And so you can go up there and you can check them out on that website, see all the information on it. Again, they'll give you a free consultation. You will be talking to Dr. Singer, the partners. His name is what?
Dr. Brendan Levy.
Okay.
Thanks.
And again, the number is 480-757-8000. And I'm going to let everyone keep on calling, because if it's you or someone you know that's dealing with this, we all know they can't stand that feeling. So give us a call here at 602-277-5369. It's gastrotrim.com.